Hi, Dr. Stone. This is Ryan Hill with KIN353, and I'm doing powerlifting for my critical assignment. So, powerlifting consists of the squat, bench, and deadlift. Competition can be single lift, geared, raw, or age restricted. So, single lift would just be something like just doing the squat or just doing the bench. Gear is going to be anything that really assists with the lift. So, that could be a compressive bench shirt, that could be a squat suit, that could be wrist wraps, that could be, knee wraps, really anything like that that's going to help you complete the lift. And raw is any meat without that stuff. I do not believe, actually, I know lifting belts do not count as lifting equipment because they are purely protective. They don't really offer much as far as benefit goes, as far as increasing maxes and that kind of stuff. Standard competition is multi-event and geared. So in standard competition, each lifter gets 3 attempts on each lift. So they get 3 squats, 3 deadlifts, 3 benches. Actually, 3 squats, 3 benches, 3 deadlifts in that order. Judge determines whether the lift counts based on the rules of the lift. So they don't want to see stuff like for squat, not hitting depth. For bench, you have to have a pause at the bottom. And you have to go on the lifter's commands on bench press. So they'll call down, up, and you have to act accordingly. On the deadlift, they don't want to see any hitching, that kind of stuff. Lifters are always separated by weight class and gender. As far as I know, I have never in my life, I'm very, very, very involved in powerlifting, and I have never once seen a combined gender or a combined weight class meet. I've never once seen it. I don't think they exist. So, never even heard of one. So I'm just going to assume that they don't exist. All right, so factors for injury in powerlifting are spotter negligence, raw versus geared competition, travel time to competition, gender and age, and weigh-in preparation fatigue. So spotter negligence is going to be the spotter just not doing their job. They let the weight fall on you on a bench press or on a squat. You pass out while you're doing a deadlift and nobody catches you. That kind of stuff can lead to injury. Raw versus geared competition. So equipment can help with stability. Stuff like wrist wraps. Take the load off your wrists. Stuff like the squat suits and the knee wraps and your what's the word I'm thinking of? Your bench suits is going to take some load off the pec major tendon, and we'll get into that more in a little bit. So having that equipment readily available is going to prevent injury at least a little bit. Travel time to competition can increase fatigue. Really, it's just fatigue in general is a big factor in injury in powerlifting. The more travel time you have, the more fatigued you're probably going to be, which leads to a higher rate of injury. Gender and age can play a big part in it. Having the strength to adequately move the weight that you're using, can be affected by gender and age. And then weigh-in preparation fatigue. So that is really just consisting of fasting, pre-weigh-ins, trying to cut weight. The more energy you have in your system, the more energy your muscles are going to have to work towards protecting yourself. You're not going to have that giving out that you might with built-up fatigue. So that can decrease injury. Common injuries, the 3 that I'm going to be going over today, are lumbar strain, tendonitis, and a pec major tendon rupture. So lumbar strain anatomy. So lumbar strain is when the muscles of the lower back are placed under excessive tensile force, which causes the muscle fibers to tear. The severity of the strain is correlated to the percentage of torn fibers, with a higher percentage of torn fibers showing a more severe strain. So they're ranked by grades 1 to 3, as seen on the image here on the right. And although technically all of these grades are sprains, they're referred to differently. So a grade 1 sprain is normally what people refer to as a sprain. Grade 2 sprain is normally a pulled muscle, and a grade 3 sprain is a what people call a torn muscle. Um, so I'm going to be, whenever I refer to strain, I'm going to be referring to a grade 1. Lumbar strains are both a chronic and acute injury. The muscles of the lower back do receive damage and micro tears from regular exercise. Usually, they're not dangerous in themselves, but they can weaken the tensile strength of the lower back muscles. Really, any muscles, honestly, but since we're focusing on the lower back, um, and can lead to acute injury muscle. Excuse me, and can lead to acute muscle strain if they're not allowed to recover properly in between sessions. Additionally, the athlete is more susceptible to strain injury if they practice improper form. The squat and the deadlift, two of the three lifts in powerlifting, are two modes of injury that are most commonly associated with lumbar strains. As the angle between the torso and the legs decreases, so that hip angle, the load on the lumbar spine increases very significantly. So at 20 degrees of flexion, the strain on the lumbar spine can increase by 50%. And adding 20 kilograms to that, or 45 pounds, at this position can increase the strain by 220%. So imagine how much strain is going to be placed on the lower back when you're having guys pushing, you know, uh, like 400, 500, 600, 700 pounds for squat. I mean, that's insane amount of tension on the lower back. I kind of packed these tight. All right, so lumbar strain assessment, treatment, and prevention. So a standard lumbar assessment can estimate the presence and severity of injury, but in order to get an accurate diagnosis, an MRI is necessary. So for a standard lumbar assessment, you would start with palpating about around L4 to S1 for inflammation and tenderness. And then you would move into a range of motion test for flexion, extension, lateral flexion, and rotation. And all of those are demonstrated here on the left. If either test produces pain, then the muscle strain of the lumbar region is pretty likely. But like I said, you do have to have an MRI to 100% accurately diagnose this. Treatment includes rest, ice, or rest, ice, or heat compresses, core strengthening and stabilizing exercises, the use of supportive equipment, non-steroidal anti-inflammatory drugs, and stretching. And the two exercises that I have are preventative. One is the elephant walk, which progresses into the Jefferson curls. You'd be doing that at about 3 sets of 12 each leg, 1 to 2 times a week. Excuse me. And also the exercises that I have that have an asterisk next to them. Those are the ones that I demonstrated in my video, in my YouTube video, and the link to that is going to be down here on the bottom. Preventative exercise 2 is the Roman chair, 3 sets of 8, 2 to 3 times a week. And the progression of that is going to be Superman holds. Rehab 1 is going to be single leg static balance, 3 sets of 15-second holds for 1 to 2 times a day. And the progression is going to be a single leg dynamic balance. Rehab 2 is going to be bird dogs. Again, 3 sets of 15-second static hold, just 1 time a day. Progression is going to be bird dog crunches. So moving on into tendonitis. So tendonitis is really just simply put, an inflammation of the tendons. And it makes up about 24% of all powerlifting injuries. It can occur in any tendon in the body, but it is most common in the wrists, shoulders, elbows, knees, and ankles. It's really only caused by placing repeated strain on the tendons through repetitive motion. And it can lead to more severe pathologies such as carpal tunnel syndrome. That's just the main example, but there's also like tennis elbow, swimmer shoulder, that kind of stuff. Oh, and right here on the right, you can see the top picture is the Achilles without tendonitis, and then the bottom one is the Achilles with tendonitis. Excuse me, allergies are bad out here in old ATX. So tendonitis MOI. So tendonitis is a chronic injury, and there's not really any specific MOI for it. General overuse of a tendon in any capacity, whether in exercise, desk work, you know, hobbies, really just any kind of use of the tendon can lead to tendonitis. In the sports of powerlifting, the major joints of each lift will be associated with higher rates of tendonitis. So, bench press is associated with tendonitis of the wrist, elbow, and shoulder. Squat is associated with tendonitis of the shoulder, knee, and ankle. Deadlift is associated with tendonitis of the knee and ankle. Tendonitis assessment, treatment, and prevention. So, simple palpation and range of motion assessments are the most common ways to assess tendonitis. If the full range of motion causes pain or is restricted, then tendonitis is generally diagnosed. And similarly, if a joint is inflamed, swollen, or tender, then tendonitis is generally diagnosed. Treatment includes non-steroidal anti-inflammatory drugs, RICE, so rest, ice, compression, and elevation, training intervention, and this is really only when correcting form or strain is placed on the tendons when it doesn't really need to be. So an example of that could be like in the bench press. You're supposed to have that wrist in line with your forearm, but some people have the bar, right there. They have a lot of flexion, places a lot of strain on that tendon right here, and can lead to tendonitis. So that could be an example of a correction. And sometimes in severe cases, it can require surgery. So preventative exercise 1 is going to be the seated dumbbell shoulder press. 4 sets of 12, 1 to 2 times a week, pretty standard. The progression of that is going to be standing dumbbell shoulder press. Preventative exercise 2, and this one's going to be for the wrist, is wrist curls with self-resistance. 3 sets of 12 for 2 times a week. And dumbbell wrist curls as the progression. Rehabilitative exercise 1 for the shoulder is going to be banded Spider-Man climbs, 2 sets of 50, 1 to 2 times a week, and rehab 2 for the wrist extensions, 3 sets of 12, 2 times a week. And again, the asterisk exercises are in the demonstration videos. And something that I do want to note that I didn't write anywhere is that by nature, tendonitis, there really aren't really good rehabilitative exercises. You're really just going to be better off with, the treatment options rather than exercises. Since it is an overuse, like it's caused by overuse, you don't really want to put too much more strain on the joints by working them out more than they're already being worked out. Rest, ice, compression, elevation is best for treating tendonitis. And over here, the picture on the left is an example of a shoulder test for tendonitis. All right. Last but certainly not least is the pec major tendon rupture. So this is the most common severe acute injury, and it is the complete tear of the pec major tendon. The rupture of this tendon allows the natural tension in the muscle fibers to contract and pull the pec major to muscle belly towards the sternum. So as you can see here in this bottom right picture, pretty much right in line with his nipple going upwards, you can see that the muscle belly of the pec major has been kind of sucked in towards the sternum. The injury occurs when the force applied on the tendon exceeds the tendon's tensile strength, causing it to snap. I didn't put it in here, but the tensile strength of a healthy tendon is about 13,000 psi. So it generally does not happen. Oh, I do have it in here. Well, not specifically, but generally doesn't happen unless you're working at very, very high loads. So that is something to keep in mind. That is why it is common in powerlifting, or I guess more common in powerlifting. So in in powerlifting, there really is only one MOI and its variations that causes the pec major tendon to rupture, and that's the bench press. Weighted push-ups and dips theoretically could cause a pec major tendon rupture, but again, you have to have extremely high. You have to be bearing a lot of weight to tear that tendon, or already have some kind of injury to it, trauma to it. Um, Shear forces usually are what cause tendon ruptures, but the bench press doesn't really place shear force on the pec major tendon. Just by the nature of the exercise, it's mostly trying to think. I want to say it's mostly just, it's not compressive. What's the other one? It's like just regular stretching. Um, yeah, just like regular stretching tension um, is really what the bench press does. So you're not really going to rupture it from uh, shearing forces. Um, it's mostly going to be from that tension. All right, so the pec major tendon rupture assessment, treatment, and prevention. No assessment is necessary to diagnose this injury. It's very, very apparent. The muscle belly is going to be displaced towards the sternum. Bruising occurs pretty much instantly around the mid bicep and on the pec. Um, and really, honestly, across the whole chest, as you can see in this dude here, he's already experiencing bruising. He's got some on his low or on his oblique on the same side. He's got some bruising over that could just be from the weight though, from dumping the weight. But he's also got bruising on the opposite pec, and I mean it's pretty immediately apparent. I hope that you've never had the what's the word? The dissatisfaction of seeing one in person. That's not the right word, but it's the only thing that I can think of. It is brutal. I have seen one once, and it is the most nasty thing I've ever seen. It sucks. Um, but yeah, moving into that. Pec major tendon reattachment, repair, or reconstruction surgeries are the only treatments for this injury. If you do not do one of these things, then you're just stuck with a torn pec tendon for the rest of forever. So preventive exercise one is going to be bench press with a full range of motion. And then the progression of that is going to be dumbbell press with the full range of motion. And what I mean by full range of motion, I don't just mean, I have this in my demonstration video, but I don't just mean just like going down and like getting close to your chest. I mean like going down, 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 like really, really sinking into that rep. Really going through that full range of motion as far back as you can go, and as you know, and then pressing back up. Preventive exercise two, I have the pec deck for three, or pec flies, as you could, like the machine. I like to call it the pec deck. 3 sets of 15, 2 times a week. Progression, dumbbell flies. Get a little bit more stability work in there. Rehab one, medicine ball chest passes. Generally about 3 sets of 30, 1 to 2 times a day. And this is going to be pretty late in the rehab process. This is normally going to start about week 16, or sorry, not 12, or not 16. Week 12 to 16 is generally when you're going to start doing this kind of exercise. And the progression for that is kneeling push-ups. And then rehab exercise two, this is going to be a little bit earlier. So you're going to be doing isometric flies. I do demonstrate this one in my video, so you will be able to see it there. And the progression of that is going to be cable flies. And then here is my reference page. Let you look at that for a second, or I guess you could pause it if you wanted to. And that is all we got. Thank you for your time, and thank you for watching. I had a great time in this course, and God bless.